Welcome back. We've got Dr. Nimmi Kapoor. Thank you so much for being here. And you're with Breastlink. Yes. Tell us a little bit about what that is.
So I was so excited to find this group. It's a multidisciplinary group, meaning we have radiology that are all specializing in breast cancer care and breast care, healthy breast care as well. We have medical oncology and we have surgery all under one roof. We all work together to make sure that each patient is treated comprehensively. They get everything all at once.
What exactly does that mean? A patient gets everything all at once.
Okay, that's important.
You're like on a conveyor belt where
like
like
diagnosis on through your treatment, through surgery,
means that
everything.
We do screening. We check healthy, normal women. We do exams with the surgeons. We do our own clinical exam given by a doctor such as myself or Dr. John West. And then if we do end up finding cancer in someone, we do the treatment. We do the surgical treatment. We do the medical treatment all together. Dr. John Link with us is one of our medical oncologists who's well known, and we all work together to do this.
That's such a relief because it's so stressful to have to go to one place for this treatment, one place for this treatment.
It's literally all under one roof.
I feel like you didn't tell someone the right information. You know, you're communicating. So is it kind of a joint effort that you're coming together? Because sometimes it feels so scary. Like, what if I didn't tell them, that I, drink 2 glasses of wine a day or something like, I'm just making that up. I drink 3. No, just, but, just things like that where, making sure that you're telling everyone the complete information about yourself. And did you miss something? So your doctors are all on the same page.
Yeah, and we're all specialized and focused on this. All of us have done extra research, extra training, and we come together as a group every week, actually, to discuss each cancer case so that we give a complete, well-rounded opinion of what needs to be done.
So is Breastlink can also play where there's education?
Absolutely. I mean, that was one thing that I found very different from bigger, more cumbersome academic centers. We do a lot of patient education, and we spend a lot of time trying to teach patients about breast cancer awareness, breast health.
And I think your organization really personalizes it for that patient. They give it a little bit more insight as to what they have to go through or what is going to be involved here. And I think that's very comforting to a patient.
One really nice thing that we do that I learned that we do is we have a volunteer who's a cancer survivor matched to every cancer patient.
Oh, that's great.
So they actually together go through the process, and so
that's really crucial.
But is
to
that
talk
scary
to someone who's been through it, that's really
But is
crucial.
it also scary because I have an aunt who's currently going through breast cancer, and I just talked to her yesterday, and she's like, "Oh, I'm getting my peach fuzz back on my hair, and I have a few eyelashes that are coming back." And I think in some ways, yes, it's important to kind of see the progression of where you're going to go. But is it like too much information too fast for some patients?
Well, we carefully match volunteers with patients. Actually, we don't want to scare patients, but at the same time, it's really important to embrace the knowledge and know and understand what's coming, what I'm going to feel like, what to expect. Because when you're ready and prepared, it's so much easier to fight a battle than if you don't know.
It's really important to fight and not to sit back and be depressed about it. You've got to stand up and fight for yourself.
A patient through that experience when you just diagnose someone with cancer? That must be one of the scariest moments of a person's life. How do you guide a person through that experience?
It's still, for me, very emotional. Each patient's a little bit different. Each patient has a different understanding and background where they're coming from. I call them on the phone before they come in to see me. I kind of go through some very basics of what to expect when they come in. I tell them to bring a friend.
Good idea.
Do they know right there?
Support.
It's not going to go well.
A tape recorder if necessary, a notebook. I mean, I want them to be prepared. I want them to know that this is a long journey, but we're going to do this together.
Why a tape recorder?
Sometimes they forget.
To remember things.
When you're in a haze.
There's so much to divulge.
You're
in a haze. So much to digest all at once.
But is it too much to tell someone over the phone initially? I know that you're like preparing them, but you don't know where they're at in their house or what happened that day. And I think that's good because you're like forewarning them. But is it also tough?
But at what
not
great
being
time
there?
do you tell somebody they have breast cancer?
There is no right time.
There's no right time.
There is no right
This is
time.
such a great conversation, ladies. I want to pick this up right after the break. We'll be right back.